I find that weight loss surgery, or surgery after weight loss as it's commonly referred to, is becoming more and more common in my practice. Weight loss surgery involves a whole spectrum of different kinds of surgery. After patients have managed to lose a lot of weight, may it be secondary to a gastric procedure, or more often I find my patients have gone on a diet and got into a healthier lifestyle. They want to have something done for all the lax skin which remains behind.
Some patients following pregnancy or following abdominal surgery, for example, hysterectomy or caesarean sections, have an excess of skin hanging over the scar. Or following major weight loss, typically they're left with some redundant excess skin.
With abdominal surgery, the commonest surgery is an abdominoplasty. Now, abdominoplasty surgery can be a classic abdominoplasty whereby you have a straight line scar in the suprapubic area or in your bikini line, and that removes all the skin and fat from your bikini line up to your umbilicus area. The skin above that area then is re-draped down so that the skin at your umbilicus now is draped down to attach to the suprapubic area just above your bikini line. Once that is formed, a separate hole is made in the skin to bring the umbilicus out. So one ends up with a scar around the umbilicus and a straight line scar in the bikini line. Now that's a classical abdominoplasty.
In more extensive weight loss, there is sometimes excess skin around the flank area and even into the back. This typically requires more extensive abdominoplasty, either a circumferential one or what's called a body lift, where the scar extends all the way around the body, meeting at the back. This can also incorporate a buttock lift, where when the skin from the back is excised, it also lifts up the loose skin of the buttocks. Another option is to do a fleur-de-lis, where the typical transverse scar of the abdominoplasty is present, but there's also a vertical scar from above the umbilicus down to meet the horizontal scar in the suprapubic area. In addition to excess abdominal tissue, excess thigh tissue can be present after weight loss, as can upper arm excess, sometimes known as bingo wings. These can be tidied up either by a transverse incision in the groin crease or under the arm, or to make it even tighter, developing a longitudinal scar from the groin to the knee, down the medial aspect of the thigh, or down the medial aspect of the arm. Typically the stay for these ranges from 2 to 3 nights for a standard abdominoplasty to 4 to 5 nights for a circumferential. The recovery period for these can vary from about a month for a standard abdominoplasty to 2 months for the circumferential one.